President Trump declaring a national emergency over the coronavirus. There are now more than 1,600 cases and 41 deaths in the United States. Here's the president.
To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. As a result of that action today, we're announcing a new partnership with private sector to vastly increase and accelerate our capacity to test for the coronavirus. We want to make sure that those who need a test can get a test very safely, quickly, and conveniently. The next 8 weeks are critical. We can learn, and we will, turn a corner on this virus. Some of the doctors say it will wash through, it will flow through, in interesting terms, and very accurate. I think you're going to find in a number of weeks it's going to be a very accurate term.
The president's declaration of a national emergency, a lot of pressure coming from lots of directions, but he did it. Jesse, what do you make of it?
Well, it's not so much what he says, it's what he does. And when you unleash $50 billion, it's going to do a lot. The markets loved it. You know, everybody was criticizing him when he spoke on Wednesday and the markets went down, and now he speaks and the markets go up. So it's really about action more than anything. He's unleashed the private sector. A lot of people were expecting that when you bring in Roush and Google and you start ramping up testing, even drive-through testing, which we've seen happen in South Korea, and people are very excited about that. So if you really unlock the resources with the hospitals and the medical industry, people are going to be feeling a lot more confident. Now, Nancy Pelosi needs to get her act together. I don't know what she's waiting for. They need to come together and get the tax cut with the payroll deal done, along with worker relief and paid leave. That should happen now. I don't know what's taking them that long, and on Monday, the markets will respond to that very strongly. The president said he's going to get tested. That was a big news item right there, and I think we will await his results because allegedly he's been in contact with people that have tested positive, been standing next to them, taking pictures with them, and if he tests negative, a man at his age, it kind of gives you an indication about the contagion aspect.
Okay, hold on, because we have some tape of that.
Oh, okay.
Are you being selfish by not getting tested and potentially
Well, I
exposing?
didn't say I wasn't going to be tested.
Are you going to be?
Most likely, yeah, most
When do
likely.
you think
Not for
that'll
that
happen?
reason, but because I think I will do it anyway.
Will you let us know
Fairly
the
soon.
results?
We're working on that. We're working out a schedule.
So what do you say, Shannon? What do you
Yeah,
think?
I don't think that he's going to want to get a test right now for a number of reasons, including which people are going to say, oh, the president can get a test and no one else can get a test. You know that some people are going to use that as a talking point if he's like, oh, I had a test 8 days ago. So we'll see. Bret Baier pointed out earlier, it could be a test that rolls out when the whole testing kit more broadly rolls out. And he's like, and look, I'll be one of the first ones to take it, but now everyone can get the test. Maybe there's going to be a tie-in there. One of the things that made me really sad today, though, there was a lot of good news, was this thing about nursing homes and that you can't go visit. I talk about old people are my tribe. I love it, and I like to hang out in nursing homes. I do. Just people need to be cheered up.
You'd like to hang out in
I do.
nursing
I love it.
homes.
When I was a little kid, we would go every Sunday after church, and my mom would take her ukulele, and I would stand on the table, and we would sing songs to the
Why
old
would you
people.
torture these people?
I'm not saying it was good, but they were lonely and hard of hearing.
That's good.
So I think my singing was okay. But I feel like we should all adopt a nursing home in our community and have school kids who have free time now to write letters to the nursing homes and to flood them with kindness. Because
But don't
those
go.
people-
I
No,
started to
going.
panic for a second.
But no,
Where's she
don't
going
go.
with this? Where's
No,
she
but I
going with
feel
this?
like you can send letters, you can send cards,
Yes,
things over, because these people
absolutely.
are going to be so lonely and they need human contact. So I say we adopt nursing homes.
So, Greg,
That's my stimulus.
I'm struck by just what Shannon's talking about, because one of the constant points of criticism is the shortage of testing. And, of course, the president is now saying they're making an effort. I think he even had the guy from Walmart there and said,
Yep.
use the parking lots for drive-through testing.
Right.
What do you make of this?
Well, when we think about 9/11, a lot of things that took place ended up being permanent. A lot of people are still taking off their shoes. Some things you want to be permanent. For example, if there are innovations in testing, and telemedicine, I want those things to be permanent. I want to use this situation to create things where you can drive through and get a test for anything. I'm really pleasantly surprised how the media cares about his health. You know, I mean, first they wanted him out because he's insane. Now they want him to remain alive. I also like the fact that he fielded questions, unlike Bernie and Biden. But it's good. What you're seeing is very similar to what happened in World War II. Companies joining together to fight and it demonstrates that a lot of stuff is going on that's really positive. And one of the good signs about this is the number one complaint that I noticed in the media on Twitter lack of diversity. So if that's your complaint, things are pretty good if you were mad that they were all the wrong color.
What about Ambassador Birx? She's a female. That's pretty diverse.
That's so, but she's white, Jesse.
Oh, okay. Got
Come
it.
on.
That kind of diversity.
Forget about their impressive skills, you know.
All right.
Boy, you guys, you have some preoccupation.
up.
I think you should
Am
check
I?
out the Surgeon General sometime. He's a man of color.
I'm talking about the people on Twitter, not me.
Okay. Dr. Safar, the whole idea that this problem could continue was expressed by Dr. Fauci today. He said, this could be not a matter of weeks, but a matter of months. And I was struck by this. He said 8 weeks looks like what's a realistic prediction to him.
I think actually, he's said several different things. He said 4 to 5 weeks until things really start calming down and we may hit an equilibrium, which I do think that is realistic. But it could be shorter than that, probably not, and it could be longer than that. But the point is we're taking the effective measures to do what we can to slow the spread and get things under control. I think this was a very important presser today. It went on much longer than I expected. They took a lot of questions, which I think was the right thing to do because transparency is going to help. We saw the stock market respond right away, and I'm not necessarily, I know it's because, $50 billion has now been levied, but also what happened? He brought all of the private sector, which is exactly where we should have been, to be honest, earlier, and I'm a little disappointed in them at this point, and I'm going to continue to tell them that. They should have stepped up. I depend on them. I promote capitalism every day because I expect more for them, so I'm glad they're here now. I think this is why the stock market responded, and I'm absolutely optimistic that we are going to start seeing more tests, and we're going to start getting this under control.
To your point, too, it's actually good news. Doesn't sound like it. But when you say that it's lasting longer, it's because you're spreading out the burden.
Yes.
You don't want it to. This is a case where you don't want to rip the Band-Aid off because you aren't prepared for what's underneath that Band-Aid if you're in a hospital. So when they say it's going to be, optimistically, if it's 3 months long, that means they've pushed that. What do they call it? They flattened the curve.
Well,
They
let me
flattened
tell
the
you,
curve.
but also let me tell you why that's very important to do. It does seem like we're elongating the process, and that's okay because we still are in flu season. Flu tends to burden our hospitals, so we want to elongate this so we can actually get out of flu season a little bit and still be able to care for all patients.
Right.
We don't want to be burdened. We don't want to have to make makeshift hospitals out of hotel
Or
rooms.
ration care.
Like we're seeing. Exactly, that's what's happening in Italy right now
Yeah.
with respirators.
So, Jesse, I must say, going around town, I'm a little struck here in Midtown Manhattan. Restaurants, my favorite restaurant, Oceana, says they're just closing for 2 weeks. You go into some of the retail stores, and the store owners look like they're crestfallen. Like,
Juan, they're lying to you.
lying.
I was just at Oceana. They had me
Yeah, they turned you away. You got to have a reservation. I'll take care of it for you. No, it's like you get up here, there's no traffic. A lot of places are empty, and that's fine. That'll last for a very short period of time. But I do wanted to talk to you about the CDC. I didn't know this. A lot of the CDC criticism, I believe, was justified because they weren't ratcheting up these test kits apparently fast enough. Dr. Fauci explained that the CDC was not designed for a nationwide testing operation. It was never designed like that. Those systems were not in place under any administration. So the fact that they were able to do this with the private sector that quickly speaks to how resilient these people have been.
Well, I think that the concern here was that they didn't anticipate and make the preparations. And I think everybody agrees there was a problem with the testing.
You can't do it overnight, and hopefully they have
it's
it
been
together
resolved
now.
now. Yeah, exactly right. But I do want to say the president said previously, national emergency unnecessary. Today, he changed his mind.
He changed his mind long
Flexible
ago.
leadership.
Well, way to go. Way to go, Jesse.
This is a fluid
Hang in there,
situation.
buddy.